You talked about age affecting women. How about men?
Yeah, I mean, age. I mean, it's not so much as in women than it is in men. Of course, with increasing age, men's semen sperm parameters also begin to decline. All right, concentration will decline, motility might decline. It doesn't mean that there's no sperm production in those who are healthy or still producing sperm. I mean, we've had cases that back in Nigeria, then before I left, there was a couple who came that the husband was 90 years and he still had sperm production and he still wanted to make a baby at 90. Of course, the wife will be younger, maybe like 30, 40s, you know. So there are some men that are blessed that they could still produce sperm. Their production, sperm production, and gametogenesis, all those hormonal systems are still functional even at older ages. But of course, the quality also matters. There are chances that you might have good sperm production, right? But then there's something called sperm DNA fragmentation, all right? The DNA of those sperm might be messed up. That if you use them to fertilize an egg, they will create an abnormal embryo that will not yield a viable, pregnancy. So, but then that's when some of those genetic testing alternatives also come in. So when we raise embryos for older people, like if a woman is above 35, we recommend that they do a test called PGT. PGT is pre-implantation genetic testing, right? And testing is for aneuploidies, right? It's not like you're checking a disease condition, but you're checking um, the number of chromosomes, right, that are available. We know that for every normal conception, right, the total number of chromosomes should be 46 in a cell. Right? There are instances whereby you have aneuploidies, so it could be deletion or addition or gain or loss of chromosomes. So they tend to analyze every chromosome from chromosome 1 to 22, including the sex chromosomes. All right, that's what those genetic testing do. So they assess, all right, is there a loss of chromosome in chromosome 18, chromosome 23, 6. So you get a detailed profile result, genetic result at the end of the day that tells you which chromosome is affected, which one has a polyploidy situation, right, where there is more than two pairs of chromosomes. So that will help us do a preliminary diagnosis to actually hierarchize the embryos that we create as to their level of normalcy. So we are able to tell which embryo is normal, which one is abnormal. So at the end of the day, when it comes to time to transfer back those embryos back to the uterus, we can know or go by those genetic testing profiles that this is the normal embryo to transfer that could yield a positive pregnancy, whatever chance you have in that clinic, right? So with age, men can still produce sperm, right? They could probably not be genetically normal. Of course, not all of them will be. It's a game of chance, right? If they do conventional insemination, allow all of the sperm that have been retrieved, as long as they have good motility to just go by natural selection and go fertilize the eggs. Maybe the one normal sperm will do the job of fertilizing the egg. Or if you're trying to directly inject the egg into the sperm, once we choose, I mean, we just choose by chance as well, not that we know which sperm is normal or not. But at the end of the day, when we raise embryos, we genetically test them. And genetic testing means we take a piece of the embryo once it has grown at about day 5, day 6, or day 7. All right, and we take that piece and send it out for genetic analysis. They will do chromosomal analysis on it and assess whether it is normal or abnormal. So those are the options we do with age-related issues or couples considering IVF. But yes,
Wow.
men with age can still also make babies. All right, I gave you that scenario. 90-year-old man. I mean, we've had 70-year-old, 60-year-old. All right, I did a case recently. I mean, most of the time it's usually some people getting married again, maybe the third or the fourth time. And the older they found a beautiful lady they want to get married to. In some countries, polygamy is not, frowned against. There are some religion that actually permit polygamy, but not in the United States. I know. We have some Muslim friends whose parents marry as many as three, four wives. And sometimes, and some people they legitimately would divorce the first, the second, the third wife, get married to one wife per time, and at such advanced ages, they want to consider IVF because it's probably not going to happen naturally at some of those advanced ages anymore. Right.
Hmm. Wow, wow. Thank you. Thank you for sharing that.